spends a lot of time saying Canada's broken, and at the top of his list is the healthcare system. But today he made a rare policy proposal to try and fix it, and let's go through it. He's calling for a Blue Seal national accreditation program to let doctors, nurses, and other healthcare professionals work in whatever province they want. And it sounds like a simple solution, but right now in a number of provinces, the only way you can work in them is if you're accredited to work in that province, even if you're a graduate of a Canadian institution. Now, the only way the Poilievre plan will work if he gets the provinces on board, and he says he's confident they'll be able to come to an agreement.
Our Blue Seal for professions will be strictly voluntary, and the provinces will have an incentive to join. With a migraine headache for 6 or 7 hours with other screaming children, when we have thousands of doctors that could be helping reduce those wait times for all of us, but are banned from doing so because despite their qualifications, they cannot get a license. Government bureaucracy and gatekeeping prevents people in our country who are trained as nurses, doctors, and other professionals from working just because they were trained either in other countries or in other provinces. Today, we have 19,000 Canadian doctors and 34,000 Canadian nurses banned from working in our hospitals simply because they were trained in another country, including advanced countries. In Canada today, we have a doctor shortage of about 40,000. In other words, if we had all the doctors that are here today in Canada but trained abroad working in our healthcare system, we could reduce our doctor shortage by half. Meanwhile, 6 million Canadians are without a doctor. We're ranked 26th in the OECD for doctors per 1,000 patients, despite the fact that we spend among the highest budgets on our healthcare system. It doesn't make sense. Government gatekeepers stand in the way, put in place massive delays and bureaucratic hurdles for highly qualified immigrants and Canadians trained abroad to actually get licensed to practice. I met a young lady the other day who couldn't get into med school in Canada, so she went to Ireland. After she graduated from the Irish medical school, she had to go to California because they wouldn't take an Irish grad as a resident in Canada. And after she does her residency in California, she still will be banned from working in Canada. So she's going back to Ireland. There we go, losing a brilliant young Canadian to a foreign healthcare system when we have 6 million Canadians without a doctor. It doesn't make sense. It's time to bring home common sense to our healthcare system by removing the gatekeepers. And so today, I am announcing that a Poilievre government will work with the provinces to create a national merit-based testing standard to license doctors and nurses within 60 days of applying. It'll work like this. There'll be one standardized testing system. Within 60 days of an immigrant or a foreign-trained Canadian applying to work in their profession, they will be able to do the exam and get a yes or no based on their competency, not based on where they come from. This will mean we judge our medical graduates based on their merits and abilities, not based on some bureaucratic system or based on where they come from. It will also mean a national license so that an Alberta doctor can practice in Nova Scotia if he should fall in love with a lady there and get married and move across the country. It will also mean that the standards will be the same for people born here as those who come from abroad. And it will speed up the licensing of our medical doctors and nurses in this country. It's common sense. If you can do the job, you should get the job. If you are a doctor, you shouldn't be driving a taxi. You should have the chance to care for kids who are in great need at places just like here at CHEO. This idea is of a Blue Seal standard for all the professions is basically a copy of what we already have in the regulated trades. 70 years ago, the provinces and the federal government came together and created the Red Seal program, where provinces agreed to a single testing standard for electricians, carpenters, and other regulated professions, trades. It has worked. Now a young electrician can get his ticket and work anywhere in Canada. We should do the same thing for our professions. Poilievre government will work with the provinces who will voluntarily have the option to join the Blue Seal standard so that we get more doctors, more nurses, less gatekeepers. It's time to bring home the best health care in the world to Canada. It's time to bring home our doctors and nurses. Let's bring it home for Canada. Thank you, and I now turn it over to Dr. Ellis to offer more commentary as my shadow Minister of Healthcare, who's going to work on delivering this Blue Seal standard for more doctors and nurses. Thank you.
Well, thank you very much, Leader, and thank you everyone for coming today on this cold and windy afternoon. I really appreciate you all being here in this matter of critical national importance. We all know very clearly that there are 6 million Canadians without a primary health care practitioner. In my home province of Nova Scotia, there's 137,000 Nova Scotians without access to primary care. We also know very clearly that the wait time for specialist care is the longest it's been in 40 years at almost 6 months. This is an untenable position, and as I said previously, it's critical and of national importance. If we do not begin to change things now, it's going to continue to get worse. And we know that Canadians are dying in emergency rooms. This is something that cannot continue to happen in a great country like Canada, and we know very clearly that we need to change it. This Blue Seal program will make it very simple for people who want to come to this country as trained professionals to be able to know what their qualifications mean in this country and enable them to get a job so that their home country is not losing a doctor, that Canada is not gaining a doctor, and then we have a very unhappy immigrant. The Blue Seal program will solve these problems, and it will mean the restoration of this incredible healthcare system that I am very proud to have been a part of for the majority of my adult life. So once again, thank you all for coming, and we're happy to take questions.
Why it takes so long to get help when you're in the emergency room? Well, we have 32,000 nurses in Canada blocked from working for no other reason than they have no direct path to prove their qualifications. They are immigrants from around the world. One of them is Maria. This is Kim Christian. He's her husband, and she's not here today, but he was just relating the story that she came here to Canada 12 years ago. She was already a nurse, still hasn't been able to get fully licensed to practice, and she said she was able to get licensed very quickly in the United States. Tell me about that.
Yeah, she could easily practice in a heartbeat, make 5-6 times the amount that she would probably make in here. And it's just the barriers, all these obstacles to practice with your foreign trained. I'm hoping that we can see some of that dissipate.
85% of Filipino nurses in Canada are banned from working, even though in the States they can take an exam and get to work in a couple of weeks. This makes no sense. Well, and think about it, when next time you're in a waiting room for 20 hours straight. We've had a red seal for our trades workers for 70 years in Canada. We need a blue seal for our professional workers, one exam nationwide. Let's leverage federal health and immigration money to get the provinces to sign on so that Maria and others like her can take a test, prove they're qualified to hit our high standards, and get to work serving patients, earning powerful paychecks. What do you think?
I agree completely. Let's do it.
Bring it home.
Thank you.
Thank you.